Back here now, live in the Live Impact Studio on WCNC Plus. I'm Jane Monreal. September is Healthy Aging Month, and today we're addressing a very important topic here affecting millions of older Americans, and that is geriatric depression. Dr. Bernie Ranchero, a family medicine physician, and his patient Connie Thomas, who at 77 has navigated her own mental health journey, coming here on Live Impact News. Thank you, you two, for joining us this morning.
Good morning, Jane.
Dr. Ranchero, research showing millions of seniors now struggle with mental health issues, yet do not seek treatment. From your perspective as a family physician, what are those biggest barriers that we're seeing?
One of the biggest barriers is just the realization that natural aging does not include depression. When you have symptoms of social isolation or being withdrawn, symptoms of hopelessness, that is not signs of natural aging, and that is not healthy, and that we should get help.
Why is simply talking about it the first step, breaking them down, though?
That's a great question. And it's really just getting the help they need, whether it be a loved one or going to your primary care provider and getting the help and saying that I am suffering from these symptoms and these conditions.
Connie, you have been on your own personal journey with this, with mental health, decades ago. Did you find it hard to talk about it at first? And what ultimately made you open up?
Okay. No, I didn't really have a hard time talking about it because I really knew that I needed help. And in 1987, I had breast cancer. And 6 months later, I had breast cancer again. And then I had 3 small children at home. And I was single parent. And I was the only one that worked. And I knew I needed help because with the body change and having the 3 children, and I just couldn't handle it, all by myself. So I knew I needed help. So I went and talked to my doctor, and he put me on a medication, which helped. But I was on that medication for several years and the same one. And then when I retired, I always took my grandchildren to school. For 18 years I did that. That was part of my life. And I retired. They were out of high school and in college. And then it was like I didn't have a reason to get up every morning because I didn't have nothing to do or nowhere to go. So then my day would be like that. So then I went to Dr. Ranchero, which he's been my doctor for several years, and he did the gene site test on me and got the results, and he lowered my medication, which I was taking too much. And so ever since I lowered the dose, I have been a lot better. And I see things a lot different than I did. I have a better outlook on life than what I did.
Dr. Ranchero, how do you get to this point what is the process of one, empowering patients to be able to talk to their doctor about something like this, and then finding out medication, what's right, how much is right? What is the process that you go about with this?
The gene site test is a simple cheek swab. It's done once in your lifetime. And if you're Medicare over the age of 65, it's 100% covered by Medicare. And it'll determine based on your individual DNA, based on your own genes, which medications will be the most tolerated, and most importantly, which medications will work the fastest, so we're not guessing at what medications to try so that you can live the life that you're meant to live.
Okay, so from a clinical perspective, that is what genetic testing does. It helps out how to balance the two?
Yes, absolutely. Genetic testing helps us based on your individual DNA, which medications would be best for that patient. So it's individualized.
Very interesting. And Connie, seniors are usually the mentors in their own family as well as their communities. What would you say to other people out there like you? Like you said, you raised your children, and then once they were out, but when you reach that point that you realize and were self-aware enough, I mean, you had the wherewithal enough to realize that you were also dealing with your own mental health challenges. What do you tell others that might find themselves in your place?
Okay. I would talk to them as a friend, and then, have them open up and tell me how they're feeling, and then have them go to their family doctor, because you don't have to go to a psychiatrist to get help. You can go to your family doctor. And I had a friend in my family, and they were really depressed, and I talked with her and finally got her into a doctor, and she is so much better. And I don't really know what would have happened to her if I hadn't have talked her into going to the doctor. And I am doing great on the lower dose of medication, and I have a better outlook on life than what I did 3 or 4 years ago.
Glad to hear it, Connie. I appreciate your sharing of your story. Dr. Ranchero, any other message that we should let families know about their loved ones?
You know what? Really, it's being an advocate for yourself, being an advocate for your loved ones, and so that we can promote living the life that you're meant to live with peace, joy, happiness, and with some love. And I think letting patients know that as we age, they can still have that and have it to its fullest.
I like the sound of that. Dr. Bernie Ranchero and Connie Thomas, appreciate your time and for the important discussion.